no documentation of the temperature. Patient then took paracetamol to relieve it. That night, patient could not sleep as her coughing and shortness of breath became worse. Patient then took 2 puffs of her bronchodilator, but the symptoms was only relieved for a short time. Thus, patient's mother took her to the emergency department. Upon arrival in the emergency department, patient found that she was breathless when walking and was only able to talk in phrases. Otherwise, there is no history of sick contact, no headache, no sore throat, no nausea, no vomiting, no changes in bowel movement, no dizziness, no leg swelling, and no recent water activities. For systemic review, for the GI system, there is no abdominal pain, no constipation, no loose stool. For the genitourinary system, there's no hematuria, no dysuria, no urgency. Hematological system, there was no easy bruising and no prolonged bleeding. There was also no joint pain and no myalgia. For the central nervous system, there's no loss of consciousness and no fatigue, no numbness. And the cardiovascular system, there's no palpitation, no cyanosis, and no profuse sweating.
On the past medical and surgical history, my patient was diagnosed with bronchial asthma at the age of 7 years old in HUSM. Her level of asthma control in the past 4 weeks, she was partially controlled as she used the relieved inhaler more than 2 times this week. And she has daytime symptoms like mild cough. And upon further questioning, she had mild acute exacerbation of bronchial asthma 5 years ago at 18 years old, where she was given nebulizer twice at KK Bacho and was sent back home on the same day. She only has a Ventolin inhaler in case of attacks, and she is not on any other medication or follow up for her asthma. And my patient also has allergic rhinitis. Her trigger factors were dust, cold temperatures, smoke, and cat's fur. She is not on any medication for it. And otherwise, my patient denies any history of admission or surgical intervention being done before. On family history, her dad is a 50-year-old gentleman who has only history of allergic rhinitis, and he works as a businessman. And her mom is a housewife, a 50-year-old housewife who has history of eczema. And my patient is the first child, a 23-year-old lady with bronchial asthma and no other known medical illness. And her younger sister is 19 years old with eczema, and the third sibling is a 18-year-old girl with no known medical illness, and the fourth sibling is a 16-year-old with no known medical medical illness, and the last sibling is a 13-year-old who has a history of bronchial asthma. On her social history, my patient is doing her internship in Pejabat Audit, and she earns about 1,000 ringgit monthly. She currently lives with her parents and siblings in a brick house with good electrical and water supply. She has a pet cat that stays outdoor, and her house does not have any carpets. My patient also denies any history of alcohol or drug consumption, and she does not smoke as well. On her diet history, my patient consumes normal adult diet and has no known food allergy. And on her drug history, my patient is not on any medication. She does not take any supplement, over-the-counter drugs or traditional medications. And my patient also has no drug allergy. And she just has a Ventolin inhaler just in case, which she did not use for the past 5 years until recently this week when she had the attack. On summary, my patient, a 23-year-old woman with underlying partially controlled bronchial asthma, presented with shortness of breath associated with chesty cough, with greenish sputum production, nasal discharge, chest tightness, and intermittent fever since 3 days prior to admission. The shortness of breath was also partially relieved by the bronchodilators.
Okay.
On
move on.
Oh, okay. On physical examination, her vital signs when we clutched her heart rate was 121 beats per minute, which was high, and her respiratory rate was 19 breaths per minute, which was normal, and her BP was 107 over 67 millimeter mercury. Her temperature was 37.8 degrees Celsius. Her SpO2 was 96%. And on general inspection, my patient was in a supine position, propped up to 45 degrees, supported by one pillow. Sorry for the typo. She was conscious, alert, and well orientated with time, place, and person. She was not in pain. There was no signs of respiratory distress at the time of physical examination that was done, and she did not have any accessory muscle use, and she also had a respiratory rate of 17 beats per minute, 18, 19 beats per minute, which was in the normal range, and her nutritional and hydrational status was clinically adequate, and she did not appear cyanosed or pale, and there was no gross deformities or attachment on her. On general examination, her palms were moist and warm. There was no presence of peripheral cyanosis, no clubbing, no tar staining, no muscle wasting. The pulse was regular with 121 beats per minute with adequate volume. There was no flapping tremor, no skin changes. Uh, her face had no conjunctival pallor, no central cyanosis, and she also had no jaundice presence. And on her neck, there was no raised jugular venous pressure, no tracheal deviation. On the legs, there was no pitting edema. On respiratory examination, on inspection, the chest moved symmetrically with respiration. There was no chest deformities, no scars, no skin changes. On palpation, there was normal vocal frequency. The chest expands equally on both sides also. And on percussion, the percussion was resonance. There was no loss of liver or cardiac dullness. And on auscultation, there was reduced breath sounds over the left side of her lungs, and normal vesicular breath sounds were heard, but there was added breath sounds of bronchi all over the left side, but the vocal resonance was normal. On cardiovascular examination, on inspection, there was no chest wall deformities and surgical scar. There was no dilated veins, no visible pulsation, no skin discoloration, no attachment to the chest wall. And on palpation, the apex beat was felt at the fifth intercostal space, 1 centimeter medial to mid-clavicular line. And there was no palpable thrills around mitral, tricuspid, aortic, or pulmonary areas, and there was no peristernal heaves at the left sternal edge. On auscultation, normal S1 and S2 heart sounds were heard, and there was no murmur or any added sounds. On abdominal, the abdomen moved symmetrically with respiration, and the umbilicus was centrally located. It was non-distended, and there was no abdominal deformities or distension. There was no surgical scars, no caput medusa, no visible peristalsis or pulsation, no skin discoloration, no stretch marks, and there was a negative cough impulse at the inguinal region. On palpation, on superficial palpation, the abdomen was soft and non-tender. On deep palpation, there was no mass, no guarding, rebound tenderness, or any organomegaly seen, and the kidneys were not ballotable. There was no fluid thrills also appreciated. And on percussion, the liver span was about 10 centimeters. There was no shifting dullness. The percussion note on the top space was resonant, and on auscultation, normal bowel sound was heard with regular interval all over the four quadrants. On lymph node examination, no palpable lymph nodes were appreciated at the cervical region. And on summary, my patient was alert, conscious, not in pain, and not in respiratory distress. On general examination, a heart rate was increased, and upon respiratory examination, the findings all were confided in the left lung, which had reduced breath sounds and bronchi heard all over the zones. Otherwise, examination of abdomen and cardiovascular systems were unremarkable.
Okay, so now open to the floor for questions. If no question, then I will ask. Okay, yeah, Nazrin.
I want to ask Hazel, does she have any weight gain or weight changes? recently?
No, there was no weight gain or weight loss.
And how does her lifestyle?
Lifestyle, as in what do you mean? Yeah,
Like,
Nazir.
does she exercise frequently, or how does her daily activity routine?
Her daily activity routine for now, since she's working, is she does not exercise on a regular basis. She is just busy with her work and then she goes back home. So there's no really any activities of exercising other than moving around in her workspace.
Okay, understood.
Okay, before you move on to the next Nazreen. Now, with regard to exercise, what other question you'd like to ask for this patient? How is it related to asthma? What other question you'd like to ask?
Want to ask, does she active? Like to assess the severity.
Not just that, what else? How does exercise relate to asthma? Do you know?
Exercise can exacerbate the asthma.
Okay, so
Depending
how
on the
you want to
severity.
ask the patient? What question you want to ask?
Usually, how does is she frequently like do outdoor activities?
Does the attack comes after exercise or not?
Or I miss
You
the
want to
point,
ask?
Prof.
Do you want to ask Hazel or Hashini?
Supposedly, at first the weight changes. I want to ask Hazel, and for the last I want to ask Hashini.
I know. Can you ask them whether does the patient have any asthmatic attack after exercise or not?
Hashini, does the patient has any asthmatic attack before and after exercise?
Not before,
Uh,
after exercise.
After exercise.
No, Nazarene, there was no asthma attack after exercise, and she also does not take inhaler before any exercise activities.
After exercise.
Okay, move on. Who else is asking question? I'm keeping a record. If no question, then it's my turn to ask question.
Sorry, doctor. Sorry to interrupt.
Hi,
Can you hear me?
Haifa.
Yeah.
Yes.
I'm Haifa. So I think I have a question regarding for the social history. Can I ask Harshini about that?
Yeah, go ahead.
Okay. Harshini, have you do you like ask the patient whether her father had like smoking history of smoking? Because maybe patient is not smoking, but how about her father?
For the smoking part, she told that her father does smoke, but the father smokes outside the house, not in the house.
Oh, outside the house. Okay. And, another question. I think it's relevant also to us. Does for social history, does her house was near to the any construction site or factory site or maybe by the main road? Are did you ask the patient about that?
Yeah, we actually asked. She does not live nearby any construction areas. It's just that, as you mentioned in the HOPI, her working area was surrounded by lots of files. So while she was flipping through the files during her work, that triggered, the dust triggered.
Oh, so
Yeah.
previously she had no types of like episode in the workplace beside
This is
this
her first
episode.
one because she's
Okay.
actually like we mentioned, she's doing her internship. So
Oh,
like she sort of just started her internship So it's her first attack since
Oh,
she entered her workspace.
I see. She just started lah.
Yeah.
Hey, I think this is a very relevant history. So make a point of that, and maybe we can even discuss on this.
Right. Okay, I think that's all to ask about the risk factor
Okay,
exposure.
thank you.
Thank you, Doctor.
Good
Thank you,
morning.
Prof.
Do you mind if I ask two questions?
Who is this, please?
This is Moafa, doctor.
Okay, yeah.
Okay. So I want to ask regarding HOPI. You said no recent water activities, you guys, but why do you mention that? I'm just curious. No recent water activities.
As far as I know, sometimes recent water activities can trigger sometimes trigger the running nose symptom or trigger URTI symptoms. So that's why we ruled out any recent water activities.
Okay. And also I want to ask about if the patient had any extra vaccination for asthma. Do you know?
Sorry, Mofa, can you say it again?
Has the patient had any extra vaccinations for asthma before?
No, not that. She did not mention any vaccination for asthma. When we asked for COVID-19, she did say she took that vaccination. That's the most recent one that she took. Other than that, no other added vaccination for asthma.
Okay, thank you.
I mean, Wafa, what else you want to ask? You should
Hello.
ask further. No, hello.
Can you
Before,
hear me?
wait. Yes, but wait first, Danish. Yeah.
Okay.
So the thing is like the history of vaccination. Did the patient experience any asthmatic reaction after the COVID-19 vaccination? Do you know, Hazel or Hashini?
No, doctor. She just had a slight fever, but she did not have any other asthmatic symptoms. And the fever also resolved in one day after the vaccination.
Mm. So Muafa, what other vaccination or what vaccination are you trying to ask? Because you did not specify.
Oh, I was suggesting pneumococcal vaccine.
So I think you better ask a much more specific one, pneumococcal or Haemophilus influenza vaccine.
Yeah. Hazel, has the patient had any pneumococcal or influenza vaccines?
For influenza vaccine, yes, but pneumococcal immunization, we are not sure. We did not ask.
Okay. Okay, that's all.
Hello, I have a question. Hazel or Harshini, you've mentioned in the past medical history that the last exacerbation was 5 years ago, right? So, can I know what was the trigger factor for that attack 5 years ago?
The trigger factor for the last one, she mentioned that she did not remember exactly what was the trigger, but she said that it was because of dust and cold temperature. She said it started out with runny nose and then she developed cough with sputum discharge, and then it led to AEBA, acute exacerbation of bronchial asthma.
I see.
Mm.
So, for whether previously in her university days, like did she stay in a hostel or something? Like what about the bedroom? Did she like cannot clean it because of her allergy or like what? Did you ask about that?
Um, Generally, she mentioned that she tries to keep her place clean so that it doesn't trigger her asthma uh, attacks. But she did not mention in detail, and we also didn't ask in detail about her stay in hospital and everything.
Um,
Yeah.
okay, thank you.
Harshini, I have a question.
Yes, yes.
Do you hear me? Okay. My name is Zulirfan. So I want to ask one question. So you stated in the past medical history that the patient have she has daytime symptom kan? What about apa tu midnight symptom? Night symptom. Macam you cakap just now at the HOPI that she has that night she had cough episode kan? What about previously? Did she have? Just want to know did, whether it's controlled or not. The asthma is controlled or not.
We asked like before the exacerbation,
Mm-hmm.
she normally has daytime symptom.
Okay.
But when we asked like nighttime, are you coughing or what? She said no. When she wakes up in the morning, then she'll have this mild cough and a bit of running nose. That's how she is usually, but she doesn't take any medication to relieve it. And then if patient claim that it will resolve on its own lah. So that's how it is usually lah before this acute exacerbation.
Oh, sebelum ni tak pernah lah. Okay, faham.
I wanna ask.
Yes, Farah.
Okay, Hazel, so you mentioned this patient has been diagnosed with bronchial asthma since 7 years old. So, is this her first hospitalization due to asthma attack?
Yeah, we actually were a bit suspicious about that. So we asked her on her previous hospitalization before being diagnosed. She mentioned that that was her first hospitalization because of these reasons, and she was diagnosed immediately with bronchial asthma at 7 years old in HUSM. Before that, she did not have any history of admission because of this issue.
Is she have any history of getting naps or anything at clinic prior to this hospitalization?
That one also she did not have any history of getting nebulization in KK also. Her first time was just at 7 years old when she was diagnosed, and then the second time of getting NAP was on her first acute exacerbation, which was 5 years ago, where she got 2 times in KK Bacho.
So she's not on any medication now?
Yeah, she just has a Ventolin inhaler in case of attacks. But other than that, she is not on any medication, and she's not on any follow-up also.
Why
We also are confused, doctor, because she was already diagnosed in the hospital but was not given follow-up, was only given bronchodilator. So when we ask her, is there really no follow-up or you're not compliant to the follow-up? She said, memang there's no follow-up in the hospital. She was not given any corticosteroid, so just the bronchodilator Ventolin inhaler.
Okay, I think we taken note of that, and we will probably discuss this.
Hello, can you guys hear me?
Yeah.
I want to ask the presenter from the HOPI. it said that the patient took her bronchodilator inhaler more than 10 times to relieve the cough because she do not know how many number of puffs to take. But from the past medical, it stated that she already been diagnosed since age of 7 years old. So like, how come she still doesn't know how many puffs? Like no one go educate her on that or how?
When we asked her, she said because it's been a long time since she used the rescue inhaler itself. Because only she said 5 years ago it was her last attack, right? And maybe when we asked her, she said because she does not remember the amount of puffs to take. She knows she has to take the inhaler, but she doesn't know how many puffs to take. And she normally doesn't use it unless the attack happens. So the last time she used also was 5 years back.
Oh, okay. Thank you.
So Danish, what else do you want to do?
Yes.
What do you suggest to do? When you hear your colleague mention like that, then what should you suggest to her?
Maybe go educate her more on how to use the inhaler correctly and how many puffs to take so that it can be optimized in the
In
future.
fact, at the end, if you have a patient with asthma using an inhaler, we should always assess the inhaler technique as part of the examination. So did Hashini or Hazel, have you actually assessed her inhaler technique or not?
No, Prof. We did not assess her inhaler technique.
Which you should.
Yes.
You should. Okay, so next time, if you ever present this kind of case again, please make sure that you also include the assessment of inhaler technique so that we know what will be the problem. And if we realize that this is a problem, then what Danish say makes sense. We need to educate and teach her, because after this incident, she may need to start using the inhaler again as a prevention or even as to control. Okay?
Sure, Prof. Sorry about that, Prof.
Yeah, no worry. So go on. What else?
I would like to ask Hazel that she went to private clinic to
Who is this, please? Is it Kurt?
Kitty, yeah, the health doctor. Yes, Prof. So
Okay.
she went to private clinic. Why did the doctor only give cough syrup but didn't give any nebulizer to relieve her symptoms?
When we asked, because when she went to the private clinic at that time, she already told the doctor that she took 10 puffs of in rescue inhaler. So the doctor didn't want to give her nebulizer again because she already took a lot of the puffs earlier. So she was only given cough syrup. And then doctor said if you were to have the symptoms again, like shortness of breath or coughing, if it gets worsened, and the doctor asked her to come back again to the clinic.
Thank you, Hazel.
Okay. Anyone else? Last question. Then it's my turn to ask.
Can I ask a very simple question? So regarding her night attacks, does she wake up from sleep usually because of her attack or because of asthma or no?
Actually, usually she does not have any nocturnal symptoms. She does not have issue sleeping. It's just that this time, after her visit from the KK Bacho, that night she could not sleep because of shortness of breath. That's the reason why she went to ED the next morning.
Oh, I see. But she
Yeah.
doesn't wake up from sleep. She usually
Usually
just has
she,
at night.
yeah, usually she
Okay.
doesn't.
Okay. Thank you.
Okay, I think now it's my turn to ask. Is it Farisha? Have you asked yet?
No, I haven't.
Okay. So can you explain to me the lung findings? What do you think of the lung findings?
The respiratory examinations. So,
Yes. You don't have to repeat my question.
okay. Under auscultation, there is bronchi over
You don't have to,
the left.
you don't have to mention anymore. Interpret the results.
Okay. So under respiratory examination, I think there is no significant findings except for the bronchi over the left side. But I would like to know whether the bronchi is expiratory or inspiratory. And then,
Yeah, ask your colleague.
Hashini, may I ask, is the bronchi is expiratory or inspiratory?
The bronchi was mostly on inspiratory. Inspiratory, yeah.
What do you mean mostly? Is
Because,
inspiratory?
sorry, Prof, I didn't get you.
Are you saying inspiratory or expiratory?
Inspiratory.
Inspiratory, and you said mostly.
Because towards the end, very soft bronchi could be heard in expiratory, but at initial expiratory, it could be heard a bit, but throughout inspiratory phase, the bronchi sound could be heard. It was persistent.
Okay, Farisha, what else what else do you think, or how do you interpret this result?
Usually, bronchi for asthma, it is expiratory. But if inspiratory, maybe it signifies the severity of the asthma.
What else?
So bronchi meaning that there is airway narrowing.
No, okay. Are you peculiar or strange? Why only left side?
Yes.
This is the bronchial asthma, right?
Yeah, supposedly both sides.
So why is it only left side?
Maybe because the asthma is secondary to pneumonia, it only attack one side.
But is there a mnemonic changes or signs from examination?
The patient was having fever.
Okay, that's history. But from examination, what signs are you expecting to hear if someone has an infection?
Crepitation.
Crepitation. What else? Is it fine or cause crepitation?
Coarse crepitation.
What else? Takkan crepitation saja kan?
Yes.
You should know by now, isn't it? You are in week 5 of your posting, Farisha. Hello?
Yes.
Yeah, you are already in your week 5 and you still don't know what are the signs of an infection ke?
I forgot what that.
So do you know or you don't know, or you want to ask your friend?
I don't know.
Okay, tell me a name. And do a homework on this also.
Okay, I would like to call Akil.
Akil.
Okay, yes, that's me.
Yeah, you didn't ask any question also.
Yes, I didn't ask this question. So continuing the Azra part, the the respiratory examination findings of the pneumonia. So in inspection, I think we can see if the patient have severe pneumonia, we can see sign of respiratory distress. And when in the percussion, I think we can when we tap, we can feel
No,
hurt the
Akhil, you
dullness.
tell me why. Can you tell me what happened to the left side of this patient?
Okay, over the left side.
Why is this patient having asthma,
Hmm.
but only reduced breath sound and bronchi on the left side? Hello, Akhil.
So, sorry, that I don't know
So if it's
why it is only one side.
so if it's a left side, why is it only which part of the left side? You know, there's how many lobes are there on the left side?
3 lobes.
So is it whole throughout the whole left side, or is it only confined to a particular lobe?
Or the presenter did not say it about the lobes affected.
You want to ask?
Sure.
Yeah, do you want to ask?
Senior or senior or Hazel, can you like specify the bronchi and the reduced breath sound is affected at what lobe? At the upper, middle, or lower zone of the lung?
Yeah, it was present throughout all the zones.
General all this.
The whole left side.
The whole left side.
Yes, doctor. When
Is it
we
correct?
auscultated, we could hear the bronchi all over the left zone. From the apex to the bivasal also, we could hear.
So why are you not hearing on the right side also?
We compared both sides as we auscultated. So the right side did not have any bronchi.
Don't you find it weird?
Yes, actually we wanted to find any cause crepitations as well, but we couldn't hear.
Prof, actually, when she admitted, because we wanted to double check with the file, when she initially admitted, her initial presentation had occasional bronchi and also caused crepitation over the left side. But when these were findings that we found when we clocked, which was 2 days later. So 2 days later, when we clocked it in, there was no presence of cause crepitations, Prof.
Okay, Akhil, how do you interpret what they said?
So pathological findings only can be found at the left side. Assume the right side, right?
Hello, I couldn't hear you. I think your voice broke.
I'm not sure, Prof, why the right side is.
Okay, you want to ask your friend? Give me a name.
Can I ask that help from Faris?
Are you here?
I'm here at the hey Prof. Okay.
Okay, so please help your friend.
Help my friend. Oh, okay. So Akil, again, Akil, what's the issue here, Akil?
The reason
What do you
is
mean? Are you in the class?
I'm the class doctor.
Then you should know the issue, kan?
Why more on the left side, doctor?
Yeah. So?
To be honest, if ni I will confirm back lah to listen again, ask the presenter lah again about whether it is confirmed that actually the bronchi is more over the left side only. Because
Okay,
asthma.
one is that you need to confirm back again the physical findings.
Because usually
right? So
asthma.
that,
Mhm.
yeah,
Because
go ahead. What you want to say?
because usually asthma bronchi maybe on the both side left and right, if I'm not mistaken.
No, what else? What else you expect to find in asthma? Not just bronchi, right? But what other signs that you want to look for?
For the asthma, wheezing, doctor, but doesn't stay in the result. Wheezing.
Not wheezing is more of a symptoms. Patient will tell you
Symptom.
that they have a wheezing sounds or wheezing episodes. But what in the physical finding you want to look for? What are the findings associated with asthma?
Maybe like prolonged expiratory phase, doctor.
So is there any prolonged expiratory phase in this patient?
Hashini, Hashini, is there any prolonged expiratory phase, Hashini? Oh, Hazel.
We felt like there was no prolonged expiratory phase.
Okay. What else? Prolonged expiratory phase.
What else? What other signs you want to look for?
For maybe who's on COVID? Chest expansion, whether it is confirmed that there's it's more symmetrically normal chest expansion, doctor. Whether it reduce or not, because it just say that chest moves symmetrically with respiration. Can it be counted?
What else?
What else? Asthma. What else? Little features. May I also call my friend doctor need help as well?
You also need help. Okay, before you ask help, let me ask you, if there is really an infection on the left side, your colleague mentioned about a cause crepitation. And then your colleague say that she didn't hear anymore. How do you interpret that?
She did not hear anymore.
She said initially when the patient was admitted, someone heard cause crepitation. And then when Ashini and Hazel went to examine 2 days later, the crepitation were gone. So how do you make of that?
Maybe it has improved due to the treatment. Not sure that.
In 2 days time?
Oh, 2 days. Or maybe this cannot be a mistake at the first place. I think at this point, doctor, I will call her name, doctor. I will need help, doctor.
Okay, call her name.
I want to call Aiman, doctor.
Aiman. Is Aiman here?
Yes, doctor.
So can you help your friend?
So if crepitation already gone, maybe his disease already resolved. Maybe the pneumonia
In 2
already
days?
resolved. Huh?
In 2 days. You faham ke? They examine the patient after 2 days. Do you expect the crepitation to go away in 2 days?
I'm not sure how long.
If not sure, what should you do?
Confirm back the auscultation finding.
No, do a homework.
Okay.
Go and find out for me if someone who has a crepitation, if treated for an infection, how long does it take to go away? Just like a chest X-ray, if I ask you, if you do a chest X-ray at day 1, you found signs of an infection, And if you repeat the chest X-ray at day 2 or 3, you already treated the patient. Do you expect the finding in X-ray to be the same, or does it have improved? What do you think, Aiman? No, tell me, what do you think?
Maybe need a few days
Or what do
to
you know?
maybe need a few
How
days
long?
to resolve. How long?
How long? You know or you don't know?
I don't know, doctor.
You don't know means you have to do a homework, okay? So
Okay,
make
doctor.
sure you do this homework and submit your homework to me. So there are 2 questions here. One is, if you have a crepitation, you treated the patient, how long does it last? If you have a chest X-ray, if you have treated the patient, how long do you think it will last? Because this is important, because many of you like to order a chest X-ray without thinking whether or not you expect the patient to have a resolve. If there is a pneumonia, if you do a chest X-ray too early, you may not see any difference in change. And you say that, oh yeah, patient is still having infection. You give it another course of antibiotics. That is your reaction. So I don't want you all to have the same reaction. You need to understand the disease itself. If someone has a pneumonia, you do a chest X-ray at baseline, you treat it, you need to know when you need to repeat the X-ray or not. How long do you think the X-ray changes may persist? Or how long does it take to resolve after the treatment of infection? Understand?
Yes, understand, doctor.
Okay, give me the homework, yeah?
Okay. I need
The
to
other name?
message you privately, doctor.
Yes. You want to share with all your friends and email to me also can.
Okay.
You want all your friends to also
I already
you want your
find
friend to
Google. It say about 6 days
you
to
trust
resolve the
Google so much?
based on NCBI lah.
No, do a homework and then let me know. Okay?
Okay, doctor.
Do a proper homework. Not just you need to think, you have to think beyond the question that I asked. Okay? If the patient untreated, how long the X-ray changes will persist? If the patient has been treated, then how long the X-ray will persist? Same thing for crepitation. Faham ke? Aiman?
Yes, understand.
Okay. Now give me another name.
Syahir.
Are you here?
Sorry. Syahir not here.
Is he supposed to be in the class?
No. He's in another group.
Are you sure?
Yes.
Okay, if not, then he'll be considered absent, you know.
No. He's in another group.
Okay. Make sure, yeah, because if not, then we have to report this as absent.
Okay.
Kenapa? Then if it's another group, kenapa you tiba-tiba panggil nama dia?
Oh, I thought he's in this group because all the
You
boys
dah lama kan?
actually
This is
what?
already week 5. This is already week 5 and you tak tahu lagi who are in the group.
No, just we are close better.
Okay, so Hashini or Hazel, please confirm is Shakil is supposed to be in this group or the other group?
Prof, he is actually in group C, Prof. Which is
Not in
a
this group,
different,
is it?
yeah, not this group, Prof.
Okay, Aiman, give me another name.
Danish Jewel.
Sorry,
Danish Joe, doktor.
Dennis dia sudah jawab already.
Oh, ya ke?
Dennis Joe. Dennis ke Dennis Joe? Ada dua ni.
Sama je. Same person.
Dennis Joe dengan Dennis sama.
Sama. Yes.
Kenapa ada dua? Oh,
Maybe
okay.
use two device. I call Marini lah, doktor.
Kau sekali.
Come on, cepat sikit. Saya nak pergi my clinic
I call
early.
Marini, doktor.
Marini, are you here? Hello? Are you sure he's in the group also? Aiman.
Should be ada.
Marini, is she in this group? Hazel, is she in this group?
Yes, Prof. She's in
Means that she's absent, right? Can you please report this as absent?
She's in our class right now, but I don't know why she is not responding. In the participant, she's there. Not sure, Prof.
Okay, I see the name now, Marini. Tadi tak ada nama Marini. Hello, Marini, are you here? Hello? Hello? Okay, can you, Hazel or Hashini, please confirm if Marini is actually around. If she's not around, then it has to be reported as absent.
Okay, sure, Prof. I will WhatsApp her now.
Aiman, who else? Give another name.
Alicia.
Alicia, are you here?
Yes, Prof. Hello.
Okay, let's talk about the two. Yeah, I can hear you. So let's talk about the two issues that I think we were discussing just now. One is that she become an intern and then she developed sort of like dust allergy. So what do you think about that?
I think first, it might have something to do with the cleanliness of the environment she's working in. And then maybe it has something to do with the stress because patient already has underlying allergic rhinitis.
So what do you think about her asthma? What type of asthma do you think she has?
Sorry, Prof, I don't really quite get the question.
What type of asthma do you think she has?
Atopic asthma.
Allergic asthma or atopic asthma?
Allergic asthma, sorry, doctor.
I mean, you're correct. Now, if you have like an allergic asthma, or maybe you can tell me what are the kind or characteristic of this kind of asthma?
So people with allergic asthma, it's usually associated with like allergic rhinitis or eczema, and then it usually commences in around childhood.
So this patient has a strong family history of allergy.
Yes.
Mother has a eczema. There's also a siblings with asthma as well. So one is a strong family history. What else?
Patient herself has allergic rhinitis, and the first onset
Okay, so
was
patient
also in
patient herself also has.
yeah. Patient has
Okay,
allergic
what
rhinitis.
else? Okay, what
And
else?
it was stated that usually her triggering factors also involves the triggering factor also
Exactly.
involves
So
dust, smoke, cat furs, the pet danders.
okay, so that is a clear triggering factor,
Yes.
an allergen. You mentioned those are some of the typical allergen, but what else? What other allergen that you need to be aware of that you might need to educate this patient? What other allergens?
Cockroaches, mold, indoor mold,
What else? Now, this is important, Alicia. You need to know this because this kind of patient with allergic asthma, they can be triggered anytime from some of these very common allergen. Other than the one that you mentioned, another very common one is a dust mite, which will be present in your bed sheet and things like that. So that's the reason why she has to keep her environment spot clean. Her bed sheet has to be changed regularly, has to be washed, and even washed in the hot water. So all of this you need to know. Do
Yes,
a
sir.
homework and let me know what are the other allergens.
Okay, doctor.
And how do you know this patient has an allergic type of asthma?
Personally,
Any other things that you do other than the history? Any blood tests that you do?
skin prick test, doctor.
What test?
Skin prick test, or we test for the IgE if using the blood.
So you want to look for the IgE levels.
Yes, doctor.
What else? So do you know or you don't know? If you
Not
don't know,
really sure,
do a homework.
Okay, doctor.
Okay, maybe the last one before I go because they are looking for me already, the clinic. Give me one more name.
Calming, doctor.
Carming, are you here?
Yes, doctor. Can you hear me?
Yes. So what is the reason for the admission or what's the reason why this patient has an exacerbation of asthma?
For this patient, I think mostly due to lung infections. And also, in the social history, they mentioned about the dust can be also one of the trigger.
So you think this patient has a pneumonia, a lower respiratory tract infection, or this patient has an upper respiratory tract infection?
Based on the physical examination, they said during admission there's palpitation, so I think it is a lower respiratory tract infection.
What about upper respiratory tract infection?
Uh,
You don't you don't think she has an upper respiratory tract infection?
I think she can have upper respiratory tract infection also.
Based on what?
Based on
In this patient, I asked about this
coughing.
patient.
Coughing.
What are the other upper respiratory tract infection, the symptoms, or even signs? Are there any signs or not?
Sign.
In this patient, what are the symptoms and signs of upper respiratory tract infection in this patient?
Coughing, runny nose, and then fever. Fever.
What else?
And productive cough.
There's also a nasal discharge. So what signs?
Sign, maybe you can look for any redness in the tonsils.
In the tonsil or in the throat?
So
does it have? Is it? What about this patient? Does the patient have or not?
I want to ask the presenter about it.
Yeah, go ahead, ask.
Actually, Hazel, did you guys check the patient's throat during the physical examination?
Yeah, there was no redness of the throat.
Okay, thank you, Hashimi.
You're welcome.
So do you believe her?
Yes, doctor.
So what's your conclusion? This patient has or do not have an upper respiratory tract infection?
Do not have, doctor.
Do not have. Then how do you explain the symptom that you mentioned just now?
The symptom I mentioned just now,
If you say she doesn't have an upper respiratory tract involvement, why does she have all those symptoms? Runny nose, nasal discharge.
I think maybe these symptoms is related to the exacerbation of the asthma.
Are you sure? Where do you come across that? What is your reference?
Because maybe runny nose and congested nose related to allergic rhinitis.
Yes, it could be related to allergic. Because how you answer is that you say that those are related to asthma. It may be related to the allergic rhinitis. So how do you confirm that?
How to confirm? I don't know, doctor.
Okay, do a homework and let me know.
Okay, doctor.
Okay, I think that's all. I have to run. I have to see my other patients. Okay, thank you guys. And Ashini or Hazel, please pass me the attendance sheet, yeah?
Okay, Prof.
Thank you, Prof.
Thank you. Bye.
Thank you so much, Prof.
Have a nice day, Prof.
Thank you,
Thank you,
Prof.
Prof.
Thank you, Prof. Bye.
Hi.
Yin.
Ya.
Yin.
Ya.
Cakap Yin.
Apa?
Tanya body Yin. Kau member tak ada.